Next, I'd like to introduce Dr. James Wright, Colonel, retired U.S. Air Force, who was the head of the hyperbaric medicine for the Air Force when he retired. Jim is the investigator for one of the 2 just completed observational clinical trials. He will give a summary of the preliminary results of his trial. And by the way, Jim's Marine son lost his arm and had a TBI from an IAD in, I think, Iraq?
The RPG in Iraq.
Iraq. Both arms.
James. So, as you heard, TBIs touched our family too. But even before that, I was blessed to be in special operations, and these young men would end up in my office with TBI. People I've known, I was there for a while, since they were wet behind the ears and healthy young souls, and they go off to war and they come back, there's something different. They're not the same person. So I understand your pain when you saw your son, and we knew that we had to do something. We do not have the luxury as a nation of standing by, slowly accomplishing the military studies while these people deteriorate in their personal lives and their family lives, become unemployed, become addicted to drugs or alcohol, and everything goes away. So we do good graces, the National Brain Injury Rescue and Rehabilitation Project. We were able to treat 70 individuals in the first part of the study. Dr. Mosiani, Rob Beckman, Steve Reimers were part of that. We treated some active duty, 8 active duty, Marine Corps, Air Force people. Everyone active duty who was treated was able to stay on active duty in their job. Not a different job, not a made-up job. And some of these individuals were undergoing medical evaluation boards on their way to being discharged. Those who were unable to go to school were able to go back to school. Those who were having marital problems had those problems improved. They were able to stay married. Nobody got divorced. Those who were taking boatloads of prescription drugs were able to either eliminate those drugs or to reduce them. And oh, by the way, they all got better. Their headaches went away. They started sleeping through the night. They were less irritable. Their cognitive problems went away. Their fine motor skills came back. Not everybody was completely cured, but some people became completely well. Imagine how great that must feel after being for months, for years, not well, knowing that there's something dreadful wrong with you. And this was all done pro bono. No tax dollars were spent doing this, and thank every one of those centers that participated and the good-hearted Americans who made that happen. So we're still plugged in to talk to the FDA and do the next phase. We want this to become so commonplace that every insurance carrier in the nation, the VA, the DOD, will pay for this so that we no longer have to round around finding people to treat folks for free, which I'm happy to do. I have a very convincing telephone call I can give. And, or beg for donations to make this happen. We sent these young folks to war. We need to do whatever it costs, whatever it takes to fix them as well as we can. That's our moral responsibility. And thank you, Admiral, for putting this up.
Thank you, Jim.